With me now, Dr. Mohamad Allaf, Vice Chair of Urology at Johns Hopkins, and also a CNN contributor and author of First Woman, Kate Anderson-Brower. Nice to have you both here. Really glad to hear that the First Lady is recovering well this morning. Doctor, what is significant about a procedure like this, and how serious is it?
Yeah, so embolization is a procedure. It's serious, but not surgery. An IV is placed in the upper leg, and a catheter is threaded into the kidney and steered to the proper blood vessel to block blood supply to an abnormality in the kidney. In a woman approaching the 5th decade of life, that's going to be either a benign growth of the kidney called an angiomyolipoma or a vascular problem, a problem in a blood vessel, both predisposed to bleeding, and given the elective nature of this we just learned, would be preventative rather than treating an acute problem.
Given that, is this timeline for her staying in the hospital 2 or 3 more days, according to the President this morning, is that typical?
I would say it's somewhat atypical, but not out of the question. It's hard to tell without any more details. It may be just out of an abundance of caution and privacy, but certainly, staying a little longer may imply that this is a little bit more of a complex situation. The larger the growth in the kidney, the more side effects that can happen from the procedure, which would imply additional monitoring. Sometimes a second stage of the procedure is performed because the growth, for example, may have multiple blood vessels, and so they may just want to evaluate for clinical success. Clearly, they said it was technically successful, so they blocked the blood vessels that they wanted. The question is, did they achieve the desired result in terms of shrinking whatever abnormality it is?
Let's certainly hope so. Kate, to you.